so much for coming. We are slowly getting extra chairs. I apologize for the inconvenience. We set up for 50 and we need more than 50, and that is a really good thing, right? That is a very good thing. My name is Kathy Maycumber, and I'm a social worker here in the Great Lakes Bay region. I have worked as a social worker in this community for the last 33-ish years. I'm a gerontological social worker, so my experience has been working with older adults for the most part, in nursing homes, in older adults who use home care. As a social worker, people need my services when they need something. I don't get a lot of, yay, everything's going great, and so I need a social worker. Right? That is not my life. My life is helping people who need help, and we are at a point right now where a lot of people need help. So I am here to be sort of the person who's giving you directions to places. We have bathrooms all the way down at the end of the hall where you came in. If you turn right instead of turning left to go back to the elevator, you've got the men's room, a family restroom, and the women's room down that way. We are going to have some great speakers, presentations this evening. I will be coming back and forth up here to help facilitate that. I do want to measure expectation, though. I want to sort of level where we are right now. This is an informational town hall. We are here to provide you with information about the impact that this might have on our community. This will have on our community if it goes forward. We cannot stand up here and give you answers. There aren't answers right now. There are only questions. And so there will come a point in our time together this evening where we're going to ask you what your questions are. And we want you to tell us those things. And when we get past a couple of our speakers, get through a couple of our speakers, I'm going to direct you to some of the information that we have available to you and that you'll be able to take with you later this evening. So with that, I am going to get us started by asking my colleague and fellow social worker, Laurel Hamus, to come up and start the presentation.
Thank you so much, and good evening. I am standing in front of you today, like Kathy said, as a fellow social worker, colleague, community member, and somebody who cares a lot about this issue. So today, we're going to be talking about some of the facts related to what these cuts could mean, not only for the state of Michigan, but for our community. And as somebody who has lived in Saginaw her entire life, I know that this has astronomical impact. So, what is Medicaid, right? It's a federally state program covering 90 people in the United States. Sure, we all know that, but just wanted to get that basic definition out there. But it is the largest health insurance program in the country. This impacts so many people, 1 in 5 adults ages 19 to 64, right? Just in your row, there's more than 5 chairs, more than 2 people just in your row, right? If you're thinking about numbers, 2 in 5 children, 3 in 5 nursing home residents, 1 in 6 Medicare beneficiaries, and 3 in 8 people with disabilities. I know numbers can be like, how do you quantify that in your brain? But you think about it as your neighbors, your coworkers, your grandparents, because federal proposals to cut $880 billion from Medicaid over the next decade could have catastrophic impacts on the people that you care about in this community. And Michigan could use up to $16 billion in funding between fiscal year 25 and fiscal year 34. I don't even know how to conceptualize $16 billion, but I know it's a lot of money that could go impacting a lot of people who are in need of services. So what's at stake in Michigan specifically? So reduction in eligibility for Medicaid, including Health Michigan, with a 90% federal funding match. These federal dollars that go towards supporting people in this community are just, again, impactful, but they hurt hospitals, nursing homes, ambulance provider, primary and specialty outpatient care, including behavioral health services and pharmacies. These are the healthcare infrastructure pieces that we rely upon every single day. I know I have to go to the pharmacy and pick up a prescription tonight on my way home. I have a dentist appointment tomorrow. I have all of these different healthcare things just happening in my life every single day. But these cuts could mean detrimental impact to this infrastructure. And you don't think about it all the time as you need something until you need it. But it's here and it's happening now. Work requirements that restrict Medicaid eligibility and access to health care as well could go into effect. So this could also lead to a possible shift to block grants or per capita caps and permanent federal funding limits. I know all of these are really a lot of words and a lot of information to be shared, but the bottom line is that there is so much here at stake in Michigan. There's so many Michiganders who rely upon these programs, and really making it aware so that we all know just how deep of an impact this can make is what we're here to do tonight. So I think I'm a visual person, and I really, really enjoy looking at a nice pie chart or a nice graph, but you can look in this pie chart and see just exactly what is at stake in Michigan. So the total Michigan Medicaid budget is $26.9 billion per year, and 70% of that comes from the federal government. That's a big number. And 33% of hospital care, 18% pharmacy, behavioral health, long-term care, physician, and other, and dental as well. There's not a lot of ways that Michigan can make up that 70% deficit if it is cut from the budget. So that is essential healthcare services being cut from our most vulnerable populations of people who really need these services to continue to thrive and be healthy and pursue their lives. And yeah, when I first saw this graph, it just shocked me because I can't even fathom this being cut. But it's at our doorstep. This is not a tomorrow or a 1 year from now issue. It could happen tomorrow. So I'm glad that we're all here caring about this tonight. So Medicaid provides healthcare coverage for more than 2.6 million Michiganders each month. Children, older adults, and people with disabilities, people in rural and underserved communities, behavioral health and long-term care recipients. This is not just, and like the city of Saginaw, the city of Bay City, even in rural areas like Standish and Chesaning, these are communities that are so important to the Great Lakes Bay region that would be detrimentally impacted by these cuts. And I think that that's so important to leave as before I introduce the next person that is here to talk to us tonight, somebody who is working in the Saginaw County Community Mental Health, somebody who is a leader and an advocate in this space. I would like to take this time now to introduce Sandy Lindsay, who is going to come up and share some of her stories about this topic.
Your keyboard here. Okay. Good evening, everybody. Oh.
That's all right. There we go.
Okay. So anyway, good evening, everybody. I'm the mental health director in Saginaw County. I've been doing this joyful work for almost 25 years next month. I've come to embrace the Saginaw community and the region. And I don't remember ever a time in my career where I was so dismayed by what is so foundational to what myself, our staff, and our network do every day. My task tonight is to really level set, to do a little bit more detail on what's already been shared, to really talk about the impact on the healthcare landscape and the infrastructure resulting from the loss of federal Medicaid dollars to our state and the country, actually, right? So that $880 billion is what's facing every state and every territory in the country that has a Medicaid program, and they all do. So the threats of these looming, monstrous federal cuts are real. The cuts to the program being discussed in the U.S. Congress start tomorrow. They're huge, and so is the impact on the beneficiary and the healthcare system here in Saginaw and across the mid-Michigan region. Such cuts would jeopardize the health, independence, and financial stability of all Michiganders, and I'll get to that in a minute, including the more than 2.6 million beneficiaries enrolled in the Medicaid program in any given month. Medicaid programs across the country collectively, as you've already heard, represent the single biggest payer of health care in the country. The financing of Medicaid since the inception of the program in 1965, who's old enough to remember 1965? A lot of people in this room. Okay, 58 years ago. And since that time to present day, the funding of the program has been a shared responsibility between the federal government and state governments across the country. The amount of federal funding to states is based upon each state's average per capita income. In Michigan, the federal match for traditional Medicaid is 65%. 65% federal and the balance to the state of Michigan. Now, obviously, per capita incomes across the country are different. So who's heard on TV these Medicaid cuts are going to hurt red states more than blue? Who's heard that? Okay. The reason for that is because per capita income is probably lower in those red states. So they're getting more federal Medicaid, so the cuts represent a bigger proportion, right, of their budget. However, in 2014, a lot of states expanded Medicaid to something we call here in Michigan, Healthy Michigan. If you look at your Medicaid card, it's not going to tell you you're a Healthy Michigan beneficiary. But you were part of a subpopulation of people in the state, people who worked and have employer health insurance, couldn't afford it on your own, met a means test, and you too got enrolled in Medicaid, okay? The match on Healthy Michigan or Medicaid expansion in every state that enacted that legislation is 90%. 90. Medicaid is the backbone of Michigan's healthcare system and ensures access to critical services for some of the most vulnerable members of our communities. Over 1 million children receive healthcare coverage through Medicaid in our state, and nearly half of all of the children who live in Michigan. Excuse me, I got a tickle, bad night for it. Michigan has one of the largest school-based Medicaid programs in the country. Cuts to Medicaid would reduce access to health services in schools, especially for students with disabilities and those in need of behavioral health support. Medicaid covers primary care, prevention and treatment of chronic diseases, things like diabetes and heart disease, and just to name a few, including inpatient care, outpatient care, and pharmacy, which has already been mentioned. Over 68,000 seniors in Michigan depend on Medicaid for long-term care services, either in nursing homes or home-based assistance. Over 300,000 people in our state with disabilities, including mental health conditions and substance use disorders or persons with intellectual and developmental disabilities, use Medicaid to access services that help them live and work. So Medicaid for them is not just their health care. It's the staffing that helps them be independent. It's all the programs that help them become integrated into the community. Over 740,000 low-income adults and working families depend on Medicaid to cover the cost of basic health care through the Healthy Michigan program. Remember I said it's 90%. So if you think like the dark side, all right, and you're going to cut something, I think that's a very vulnerable population, in my opinion. Last year, Medicaid covered the cost of 45% of all the babies born in our state. In rural Michigan, because this is sort of a regional forum and I want to be mindful of not just urban areas like Saginaw, but the rural parts of our region. In rural Michigan, the percentage is even greater, as the cost of the majority of births in Michigan rural counties are covered by Medicaid. So much more than 45%. This makes Medicaid a key financial support for maintaining obstetrics and pediatrics in those same communities, right? Medicaid helps to lower costs for beneficiaries so they're not forced to go into debt to cover the cost of their health care. And I'm here to tell you that bankruptcies for out-of-pocket catastrophic medical costs are real. Without access to care, preventable medical conditions will go untreated. These situations can escalate into emergencies or even life-saving circumstance, which are far more expensive to treat and harder and more complex to treat. Let's talk about the economic impact on our state that's represented by these cuts. Beyond its importance to individuals and public health, Medicaid is a major economic driver for Michigan. The programs support $26.9 billion in annual health care services, has already been shared, with over 70% of this funding provided by the federal government. Healthy Michigan alone brought $1 billion in federal funds into Michigan and supported more than 10,000 jobs. Michigan hospitals receive nearly $7 billion each year through the Medicaid program, which accounts for almost 1/5 of the net revenue of hospitals on average across the state. Since the start of Healthy Michigan in 2014, hospital uncompensated care has fallen dramatically, decreasing by more than 50%. These federal cuts could start increasing uncompensated care at hospitals overnight. Healthcare is one of Michigan's largest industries, pumping $77 billion annually into the state's economy and more than $25 billion into local communities. The State Budget Office has indicated that more than 29,400 Michiganders could lose their jobs if these cuts are not stopped or modified and go into effect. The proposal that in Congress to cut federal Medicaid by $880 billion over the next decade, as outlined in the U.S. House Budget Resolution, would be devastating for Michigan for obvious reasons. The Michigan Department of Health and Human Services anticipates our state's share of that cut to be $16 billion, maybe exceed $16 billion, because nobody knows how the cuts are going to come. The proposal in Congress to cut federal Medicaid by this amount is unconscionable, and I think we have. Next year, in calendar 2026, our state would experience the following if these cuts go into effect. $2.2 billion in lost federal Medicaid funding. We've already mentioned that would be the first year of 10. $4.9 billion in lost economic output and $2.9 billion in reduced state GDP. The Michigan Medicaid program makes up 33% of the total state budget. Excuse me. With 70% of Michigan's Medicaid program supported by the federal government, I'll be really honest with you, the state does not have the kind of money to backfill what the federal government has abandoned. They do not. I've been on multiple webinars with multiple state officials, and that's the message. Cuts of this magnitude would force impossible choices, shrinking access to care, shifting costs onto state budgets and local providers, and threatening coverage for seniors and nursing homes, those receiving care for chronic health conditions, veterans, people with disabilities who need daily support, and working families who can't afford private insurance. Worse still, the damage would not stop with those who rely on Medicaid. So this is the message you need to take to your friends that are not on Medicaid, okay? These cuts would destabilize the entire healthcare system. Hospital birthing centers, mental health clinics, nursing homes across Michigan depend on Medicaid to keep their doors open. If that funding disappears, many of those facilities, particularly in rural areas, will be forced to shut down, leaving entire communities without service. And when hospitals and clinics close, it does not just close for Medicaid patients, but for everyone. Whether someone has Medicaid, private insurance, Medicare, it will not matter if there is no place to go. These closures could create healthcare deserts, particularly in the rural parts of the state. straining the remaining regional providers, probably in urban areas, putting all residents at risk with fewer options, longer wait times, and reduced access, particularly during emergencies. These are not just statistics. This data is what represents the real threats to our neighbors, our coworkers, patients, and loved ones. Michigan simply cannot absorb these funding losses without widespread and lasting harm to people and communities across our state. So that's why we're here tonight, to stand up and be heard. So thank you for your time.
Whoa. New equipment, I don't even know how it works. Let's see. Okay, so we do have one more speaker, and she is going to give us some insight into the impact of this on Medicaid beneficiaries. Jean Irwin.
Good evening. My name is Jean Irwin, and I'm here tonight not as an expert or a political person, a caregiver, and a proud member of this community. I am. I've been a hairdresser for almost 40 years. I've met thousands of people in my chair, people with stories and struggles and strength, and now I'm here to share a piece of my own story. Right now, I am a primary caregiver for 3 people, 4. 2 of my brothers are learning delayed, Down syndrome, and my older brother was cognitively delayed, born that way, and severely dyslexic. He is married, and his wife is just like him, and they're a perfect match. They've been married 17 years, but I am their guardian and payee. They just went into an assisted living without Medicaid. I would not be able to have put them there, and they are having a great time. All 3 of them depend on Medicaid to meet their basic health needs. I am also guardian for my granddaughter. She's 6 years old. Without Medicaid, I would not be able to get her the care she needs at her pediatrician, her shots, her checkups, everything that a child deserves. I was also a foster mom when my children were toddlers and babies. And every child in the foster care system is, Medicaid is what takes care of them. Recently, my brother had chronic health problems. Medicaid helped him get the medications he needed, health care at the hospital that he needed. My sister-in-law had a medical emergency without Medicaid. I don't know what I would have done. I work hard every day, like so many of you people, but like so many families, I don't have access to afford private insurance. Medicaid is what keeps my family afloat, and it's not a handout, it's a lifeline. When I hear about $880 billion in cuts to Medicaid, when I hear that Michigan could lose up to $16 billion, that is not just a number to me. That's my family. That's doctor visits, medicine, it's peace of mind. And I'm not here to talk politics, because I'm not good at that. I'm here because real people are going to be hurt if these cuts happen. People like me, people like the ones I love, that I serve every day in my salon. We are your neighbors, your church friends, your coworkers, your customers. We matter and we deserve to be heard. I am not a public speaker, and I am very, very nervous. But I'm standing here, thank you. I'm standing here representing my brothers and sister-in-law, my granddaughter, all the foster kids that deserve help. And I came because this is too important to sit back and be quiet. If you care about your community, about children, about the caregivers, and people just trying to get by, you need to speak out too. I'm asking you to stand up for Medicaid, speak out, stay engaged. Together, we can make a difference. Thank you.
didn't she? They both did. Thank you so much for what you had to share with us. So now we're going to get to the Q part, right? I said there weren't answers, but we do have, many of us, questions, and we need to hear from you. So we're going to be joined by Allison from the Woman Group, who is going to lead us through this next section. We will have handheld microphones that we can bring to you so that everyone can hear your comments. We ask you to keep them pretty brief just because there are way more people than we expected in this room, and we want to make sure that we get a good representation. We can't get to all of you, right? We know that. We can't get to all of you, and not all of you want to stand up and say this in this forum, but we do have methods for you to engage. We have comment cards that we would like you to fill out and put down if you want to leave your name and your email address and your phone number so that we can keep communicating with you. You can do that. And then we have some handouts with a script because, as my friend Jean said, not everybody's a public speaker, even though she's a great one. And not everyone is, and so sometimes you need that script. So we've provided the script to you. We've provided the contact information for your representatives. If you're not sure who that is, we've got a map. So that can help you. If you're really not sure because you're on an edge somewhere, I'm able to go in and find your legislator for you. So I'm happy to help you do that. And you can take those handouts with you and contact at your leisure, but definitely contact, right? So thank you. Allison.
Thank you. So did you want me to go through this first or do the Q first?
Let's go through this first. I'll actually stay up here for a second so that
It
you
doesn't
can
go
talk about
blank.
this and I'll go to the next one.
Okay, so what is the urgency? Why are we doing this tonight? Oh, let me go back up. My name is Allison Wilcox. I'm with the Women of Michigan Action Network, or WOMAN, in Midland. We're located in Midland. The other sponsoring organization here tonight is Mid-Michigan Indivisible from Chesaning. It's a brand new group. We're part of a network. We're part of a grassroots network that works to advocate and to push our government, our representatives, to do what we think is the right thing to do. And I will tell you, George Soros hasn't given me any money, not one penny. So what I have been doing for the past couple of years as an activist, a volunteer activist, is helping people understand what's going on and what you can do. So the reason we're here tonight, is this coming through okay? Okay, all right. I'm used to mics that you have to hold right on your mouth. So the reason we're doing this tonight is because the rubber's meeting the road in Congress this coming week. So here's the urgency. In February, the House passed a budget resolution calling for $880 billion in major cuts. And we've already seen, for those who follow the news, you might have seen the president's budget coming out. He wants to increase military spending, and he wants to decrease spending in almost every other area. So we know the House has passed a budget that calls for huge cuts. This week, they start looking at the budget and figuring out where they can make those cuts. And frankly, some of the conservative elected officials think that Medicaid's a good place to make cuts because there's a lot of waste there, right? Right. Now, I'm all for cutting waste and fraud and inefficiency in government, but this is not the way to do it by just saying we're giving you less money. So this week they start marking up the Medicaid budget of all the budgets, and then by May 26th, by Memorial Day, that's the goal for the House to vote on this. So this is the time frame you have to contact your congressman or congresswoman, your congressional representative. And then it moves to the to the Senate. And so you have more time to contact the Senate, but I recommend you call multiple times before they get to the vote because they need to hear that pressure constantly. So this is the timeline that we're looking at as far as urgency. Okay, Q now?
So
or?
Yep, let's do that. So
Okay.
we'll give you more information at the end. You'll have some QR codes up here and things like that after we have the opportunity to.
Right. So you may have noticed my shirt. The back of it says, "Action is the antidote to despair." When you get really despairing about things looking bad, you must take action, and that will help you feel better. So in a minute, we're going to hear from some people who are going to share questions that they have. And I will tell you, we don't have the answers tonight. We just want to hear your questions, just very briefly. Maybe you can share a bit of your experience with Medicaid or how it would impact you. And then we'll talk to you about how to contact your legislators, what to say when you contact your legislators, how to be polite but firm when you contact the staff that will answer the phone. I'm seeing Kevin over there smiling because he answers the phone quite a lot for Kristen McDonald-Ribbit. So does anybody have a story they want to share or a question they want to ask, remembering that we're not going to have the answers tonight? Just if you can limit it for 2 or 3 minutes. Who's got the mics, taking them around? Okay, we've got questions up here. Okay, since you've got the mic, go ahead.
Pardon my emotions, but for what we're experiencing right now is quite terrifying. And as a community activist, I understand, like many who's not involved or seek to really understand politics, I understand what we're facing, and my biggest concerns are with our elderly, in which many of them have barriers that prevent them from being at meetings like this. So as an action plan, my sister friends and I and some in the community, we're focused on helping the elderly, and we're here tonight to see what type of ideas or what kind of help can you all give us so that we can help our elderly safety plan, starting with the income-based housing elderly. Those individuals will be the ones who will be impacted first, and we have so many that don't understand what's going on. And so the information that the young lady shared about the statistics and the impact, I hope that that information will be available, because those will be tools that we can use as we go to the elderly and share with them the facts of what's going on. So we want resources to help us.
Yes,
help them
absolutely.
safely
I think
plan.
we do have handouts that are based on these slides to give people. Is that right? Am I missing? Yes. Okay, so we'll have some handouts so you'll have the information on this slide, plus the QR codes and the information on how to contact elected representatives. So thanks for standing up. And we got some folks up here.
Hello, everyone. My name is Derek. Since becoming a member of Bayside Clubhouse, I have gained employment, built friendships, have helped other people learn about Clubhouse. If I lose my Medicaid, all of my Clubhouse colleagues and I will lose all these opportunities, and all that we give back to Saginaw. And to furthermore say, it will impact us with mental illness, because these cuts are really discouraging and very frightful
It's
for some of the
stressful,
mental
right?
illness, for the people with mental illness, because we have barriers to that we face in the real world, and most people don't understand that mental illness is real. They think it's not. We're not capable of finding a job, employment, housing, and all that for mental health.
But we know with support, you're able to do those things.
Yes.
Right. Yes. Thank you. Thank you.
Hi, I'm Jeff Larson. I just wanted to say that respectfully, you said that you don't have answers, but you gave us the biggest answer. The biggest answer is you have to take action. Yes. You have to call. You have to tell what the impact of this is. And we're not talking about the entire U.S. government. We're talking about 217 people who took a recommendation and took it seriously. And that's not the Senate. The Senate number is 1 billion. There are 217 people in the U.S. House of Representatives that say 880 billion is fine. And they'll tell you that the idea of cutting Medicaid is a media construct, but you can't do the math. You can't cut from the department that they said the cut has to come from. You can zero out every single other line item, and that cuts 257 billion. All that's left after that is Medicaid. So at least 630-ish billion has to still come from Medicaid. But they'll say that we're not talking about cutting Medicaid. So you have to find those 217 people, and you have to call them. You cannot leave here and not call them and tell your friends to call them. You have to pepper their offices. You have to make agreeing to this uncomfortable. If 2 of them crack and flip, job done. We don't have to have this conversation. That's what the margin looks like.
Thank you. I think he's done my job getting y'all hyped up. Anybody else have a question? I saw more there. Oh, okay, back there, and then this lady. Go ahead.
My name is Gabriel. I live here in town. I've been here since 2011 with my mom. Moved here battling and struggling from an addiction. Who is a recovering.
Hold it right up to your mouth.
My name is Gabriel. I've lived here since 2011 when my mom became clean and sober from battling with addiction over 5 years, and she has been clean ever since. To call this devastating would be incomprehensible to every single U.S. citizen within the United States. And not just here at home, for those who rely on the system, but those for workers that also work alongside the system to get the help that people need everywhere in the United States.
Right. Thank you. Thank you. Did you want to speak? Oh, okay.
My name is Michael Knoll, and I've been a diabetic for 20 years, but what I want to give you information about the people who call and use unavailable, they don't identify themselves, don't. And I just want to know that when you do answer the phone, they say they hear from Health Advantage to sell you some insurance. And I said, I do have insurance because I'm diabetic. I got a permanent disability. So I just want to know what can you do to be able to have insurance and keep them healthy, because I'm required to take medicine every day to keep myself healthy. And I know I got a permanent condition. So I just want people to be aware of the scam artists using unavailable.
Oh.
Trying to
Okay, so
sell
your
you
message is
something.
don't answer the phone if it says unavailable.
You can probably still answer the phone, but still be aware of what people are trying to get you to buy. That's what I would
Okay,
suggest.
thank you. Thank you.
Hi, I have a loud voice, sorry. I'm Sonia Garcia. So I'm here not only as a parent of my adult son, Daniel. I'm his legal guardian. Daniel has a disability. My story is that he had been employed for the past 8 years at a shelter workshop here in Saginaw. And after our current president got into being a president, he got terminated basically from his job because of the Medicaid money. They saw the writing on the wall. And so here I sit with my son who has a disability, who lost his job. And I'm trying to, provide him with encouragement, different jobs to do volunteering. And I worry about him, but I don't, because my husband and myself are able to care for him and to provide other opportunities for him. But I think about the other adults. with disabilities, who don't have the family to support them. I think about the other individuals, the children, the senior citizens, everyone else who need the extra support. What are we going to do to help them? We need to come together, like everyone is saying, and we need to, make the phone calls. We need to have them not cut the Medicaid, not cut the Medicare, anything in general. We need to get back to being a big community and stopping all this. That's all I had to say, sir.
That's a great message. That's a great message. Okay, we got some folks there.
So, I've talked to Rivard, and she's...
Could you stand?
Yeah, I've talked to Rivard, and she said she's going to support no Medicaid as
Kristen
Peters.
McDonald-Rivet.
Yeah, right, Rivard. And also Peters, and I've just talked to Slotkin. The problem is we have to get the Michigan legislator, as this man said, we have to get to the Republican Michigan legislators that are voting against this. But we're in a Democratic community right here in Saginaw, and she's already for us. Right. So how do we contact the other half of our Michiganders? Because it only takes 2 votes. You only have to get 2 votes in Congress. That's all you have to have.
That's a great question. So how many people here are represented by Kristen McDonald-Rivet in Congress? How many people here are represented by someone else? Okay, John Moulinar maybe, or? Barrett. Okay, so you guys have special extra task because she's a Republican that you can reach out to. I will also say we should maybe include state legislators in some of these calls, because you can call your state legislator and say, hey, I'm worried that federal cuts will impact our state budget. Can you work with the state to help push the Republican Congress people to vote to keep Medicaid going to us?
Amos, which is our representative locally, Amos is for Mike.
Right. Okay, thanks. Yeah.
Allison, just so that you're aware, some of the handouts that are over here, we don't just have District 8. We also have District 7, District 9, District 1, and District 2. Those are all the districts that surround our community here in the Great Lakes Bay region. So there are separate handouts for each of them with scripts tailored to each of them. So yes, Congresswoman McDonald-Rivet, her information is here, and I know she wants to hear from you, even though she's planning to vote in the way that we want this vote to go. I know she still wants to hear from you. So her information is there for you to communicate with her, but so it is for others. My daughter calls her representative every day. The person on the other end of the line, not super happy to hear from her. Answers the phone every single day. She calls, she says, this is a problem, we need something to happen. She texted me this morning and said, hey, this is another problem, I'm gonna ask him about this. She is in a Republican district. You have family, right? You have friends in those districts. Call them, give them the information that you picked up here.
Great. Okay, just 1 or 2 more. Yep, go ahead.
Hi, my name is Taylor. I just kind of wanted to encourage people, as you did, sir, to reach out. So we already talked about Kristen McDonald and how she seems to be in support of not cutting Medicaid. And I did also reach out to my legislators, including Kristen McDonald, and did get a call back asking if they could share my story that I included in kind of like a forum on their website. And I just wanted to encourage people to continue reaching out, because even if you feel like your voice isn't being heard, they're reading it, they're hearing you. And I just wanted to say that. I don't have a question at this time, but just want to continue to push for everyone to reach out.
Okay, great.
Thank you.
Yeah.
Hi, good evening. Thank you so much for the opportunity to speak. My name is Amanda Hartley. I'm a case manager and a former Medicaid recipient with Victory Clinical Services. If you haven't heard of us, we are a Medicaid-assisted treatment center here in Saginaw, and we are dedicated to supporting individuals with their fight against substance use disorder. And today, I am here to be their voice, the voice for our patients, those who are often unheard and unseen, to share why these proposed Medicaid changes are devastating to the people we serve, and why it is so important to get out there and get our voices heard. Our patients are mothers fighting to be reunited with their children. They are fathers. They are determined to be providing for their families again. Their sons, daughters, brothers, and sisters working every day to break free from addiction's hold. Many of them came to us when they had nothing left, no hope, no support, no second chances. Medicaid coverage made treatment possible. It made recovery possible. The changes being proposed would place unnecessary barriers in front of those that are already fighting an uphill battle. If our Medicaid access is reduced or restricted, many of our patients will lose their lifeline to treatment. And without it, they risk returning to streets, homelessness, to overdose, and unfortunately, too often to death. Medicaid-assisted treatment isn't just a clinical service, it is the bridge that helps rebuild people's lives. It's the reason a father can attend his daughter's soccer game sober. It's the reason a young woman can start college here again with the confidence instead of shame. It's the reason families are made whole again. Medicaid isn't just a payer, it's a partner in our mission to heal and restore lives. It allows us to meet our patients where they are and not leave them there. Too often, this is their only chance. We are offering them hope when it feels out of reach. We are here to build a path forward, and we cannot do that without Medicaid. Our patients are resilient. They have survived more than most in this room can ever imagine, but they cannot survive without access to consistent, affordable care. Treatment is not a luxury, it is essential. And it is essential we have Medicaid coverage for that. So I'm asking you, everyone, get out there. Get out to our legislators. Ask them to look beyond the numbers and see the faces. Think about the lives that are hanging in the balance. Protecting Medicaid coverage for MAT services means protecting our families, restoring the communities, and saving lives. So on behalf of every patient who dreams of a better tomorrow, I just ask you to please get out there, get your voices heard, call 20 times a day, have your friends and family. We need to make noise. Thank you.
Thank you. Thank you. Good. Thank you. Okay, one more.
Hi, my name is Kim. I've often found that what's going on in our country right now, there's a lot of stuff that they're going to do, but there's never any solutions. If they do it, now what? As a former foster parent, we struggle to get foster parents to begin with. If they don't have Medicaid, how are they going to be taken care of? And is that going to make people not want to become foster parents? Also, somebody who has worked in a drug and rehab, not having Medicaid just going to cure addiction? I don't think so. What's going to happen to these people? And someone who currently works in an inpatient mental health facility with gero and adults and children, what's going to happen to people? Their mental health issues are not going to go away just because we don't have Medicaid. So, and like I tell people when they like to stay, well, there's too many people getting Medicaid right now, and the stigma that goes with it, I always say to you, do you work somewhere where they take Medicaid? What about your job? If there's no Medicaid people coming in, they aren't going to need you, and you're not going to have a job.
Right. Good points. Yeah. Okay. Okay. Let's go on to the next. Here we go. So the next steps, if you want to contact your legislator, how many use QR codes? Everybody familiar with those? So they will be in the handouts that are outside waiting for you when you leave. But you could just take your phone right now and point it up here to help you find your legislator. So this is one on the left. If everybody knows that most of the people are represented by Kristen McDonald-Rivet, then you don't need to use that QR code. But there's another QR code. You can contact Governor Whitmer. She is looking for stories about Medicaid and how it impacts you that she can use when she goes to Congress and says Michigan needs this money. So you can share your stories with Governor Whitmer. And then, how many of you have called your state representative or congressperson before? A good number of you. How many have never called or contacted an elected representative?
And that's okay.
That's okay if you haven't. But a lot of people think that it's kind of scary. It's not scary at all. And this app, 5 Calls, is a way to help you quite a lot. It's both an app that you can download to your cell phone, and a website. And I use the website version. You go to 5 calls, you put in your address, and it then pops up with who your legislators are. And then you can pick an issue that's of concern. Now, our issue that we want you to pick is Medicaid. And it'll give you just a brief script, a synopsis of of the issues, and then a script that you can use when you make the call. And truthfully, you don't have to give a long, impassioned, eloquent speech. You just need a short, just a couple sentences to tell them why you're upset about why you don't want Medicaid cut and what it would mean to you or your family if it was cut. Now here's the script. Hello, my name is Allison Wilcox. I'm a constituent in your district. My address is, and you need to include your address so they know you live in their district, because they don't want to hear from people who live outside their district. I'm calling to urge Representative Kristen McDonald-Rivet to oppose budget reconciliation bill that cuts Medicaid, reduces Medicaid expansion, or imposes Medicaid work requirements. Medicaid is a lifeline for millions of Michiganders in underserved and rural health systems. Federal budget cuts would strip me and hundreds of my neighbors of vital health care, putting lives at risk and devastating our local economy. Thank you for listening. Now, if that doesn't sound like you, pick out the words that do sound like you. Use your own language. Really, that your own personal story is what they really want to hear. And we know Kristen is going to vote the way we want her to, but she can use these stories when she talks to her fellow congresspeople. She can get with the Republicans that might be on the fence and say, hey, I heard from a constituent that told me this, that their brother-in-law depends on Medicaid for mental health care, that they have kids that depend on it. Personally, my son is on Healthy Michigan plan because he has a job that doesn't pay that much. So it would really impact quite a lot of us. If you can mention, if you work in healthcare, that it would impact your job and how many people depend on that. So when you make those phone calls, it doesn't have to be long. You don't have to be eloquent. And if you get nervous, that's okay. Quite often, you'll end up talking to a recording. So there won't be a person listening at that time. They'll come back and listen later. They do listen, right, Quentin? You listen? You listen to all those calls. So leave your name, your address, and really briefly state how important it is to you that we preserve Medicaid and keep it going. That's true for calling Kristen McDonald-Rivet's office, Gary Peters' office, and Alyssa Slotkin's office. And as Kathy mentioned, you're not the only one that you can influence. These electeds are not the only people that you can influence with your calls. Tell your friends, your neighbors, your relatives that they need to call. How many of you have a relative that lives in another state? Yes. Okay, so my dad lives in Texas. He has a Republican legislator. He can call him and say, okay, this is why Medicaid's important to me. Your relative in any state can call their representative and say, Medicaid's important to me because I have people here in my state or I have relatives in another state. That Medicaid is a really important, essential piece of their health care and how they keep going. And especially if they live in rural areas out in the country, that is a really effective way to advocate with those conservative Republican congresspeople who represent people in rural areas, because they know what the impact would be if those rural hospitals were to close because they lost Medicaid money. Let's see, is there anything else here?
That was it.
So remember, it's call. Emails work too. You can email as well if you feel more comfortable doing that. But calling is easy. It's really effective. And I do know some people who's like, I want to write a letter and put it in an envelope and put it in the mail. And you can do that. Don't send it to Washington, D.C., though. When you find their address, don't send it to D.C., because that's going to go through checking for anthrax and being x-rayed and all that kind of stuff. And it won't get there till July, by which point they will have voted already. So calls or emails or letters to the Flint office or another local office, an in-state office also works. But calls, they're easy, they're quick to do, and the more you call, the easier it gets.
Thank you, Allison. Thank you all so much for coming this evening. Thank you for your voice. Thank you for the words that you will speak on behalf of yourselves and your neighbors and the people sitting next to you, the people who are across the state or across the country. These are voices, your voices need to be heard, and we are glad that we were able to hear them this evening. Again, there are comment cards. Leave them. We will collect them and we will put them together and send them to our legislators. There is a place for you to put your name, your email address, and your phone number. There are handouts there for you to take. We appreciate you coming out this evening, and thank you.